So, good morning. My name is Bunjo Memperos from BSN 16. Today, I will be performing assessing the thorax and the lungs. So, first of that, I need to uh, introduce myself to the client. So, good morning, sir. My name is Bunjo. I'm your student nurse today. Today, I will performing to assess to you the thorax and also the lungs. So before we start the procedure, sir, can I know your name, sir? Okay, Sir Nel, to get the name of the patient, we need to uh, uh, use hand hygiene to prevent the infectious disease. So after that, after the hand hygiene, next is for the privacy of the patient. We need to close the curtain. So let's assume I close the curtain. So after that, I need to ask the client about the history. So sir, I have some questions about you regarding the history like history about allergies. Okay, how about the tuberculosis, sir?
No.
Life habit like smoking or like occupational hazards.
No.
Okay. How about any medication, sir, that you take?
No.
Okay. So, sir, thank you. So after asking the client about the history, so we need to proceed to the posterior thorax. So I need to inspect the shape and also the symmetry of the thorax from posterior and the lateral views. Compare the anter posterior diameter to the transverse diameter. So I that's showed. Can you to inspect the thorax, the shape and the symmetry should be the client was turn around. So can you turn around, sir? Inspect the shape of the patient from the posterior and the anterior. So based on my assessment to the client, so the thorax is symmetric. So after that, I need to inspect the patient, the spinal alignment. So the patient should stand. Can you stand, sir? Hindu. So the patient should stand. So I need to observe the spinal. So I need to observe the client state position, and from lateral position, then observe the three normal curvatures: the cervical, thoracic, and also the lumbar. So the spinal alignment. So based on my assessment to the patient, his spine is normal alignment. So after assessing the spinal, we need to proceed into I'm going to palpate the posterior thorax of the patient. Palpate the posterior thorax. So I need to palpate. Stand lang. So my findings of the patient, no swelling and tenderness. So we need to proceed to palpate the posterior or anterior chest. I need to palpate the posterior chest for respiratory exertion. So I need to use my palms, both of my hands, to over the lower thorax with my adjacent of the spine and